And the state of Wyoming, as you know or can imagine, is very, very sparsely populated. They can't even compare to us. In some ways, it's apples and oranges, as I'm sure others will point out. Any state that has a city, like we do with Honolulu, and does not have a large mortality rate is really doing something special. So that's a testament to our first responders, to our nurses, our docs, to our firefighters and police officers. Very incredible. You also have often asked how many people we're testing, are we doing enough testing? So the test number we have now is 24,543 individuals have been tested. We've actually run a few more tests, so please don't be confused by that. Some people have been tested twice for certain circumstances. 584 positive tests, as I reported earlier, and that's just 2.37%. That's a very low percentage as compared to other states across the country. The reason for that is some states have only tested in the acute hospital setting, and obviously those individuals are very sick, and the likelihood of testing positive is much higher. So that's important news, and I know people want to know, are people getting better? Of the 584, we've discussed how many people passed away. The recovery rate is significant. 423 individuals have actually now recovered, and that's a 72.4% recovery rate. So it's a trend we want to have. We want to see this number obviously go all the way up to as close to 100% as we can get, and that will tell us then that we don't have active virus in our community to the best of our knowledge. So I've been receiving briefings from our healthcare team as a part of the State Operations Center, and I'm going to give some information that I don't think people have discussed much before. So we've done some very good modeling. Bruce's team, the State Emergency Operating Center, there's some terrific young people there that are working with Department of Health. And had we not had the governor's order and stopped travel here and allowed spread throughout the islands, the number would have been much worse, you're all aware. Their model showed this number. 4,479 people. That's the number of individuals that would have passed away, that would have died in the state of Hawaii based on that model, had we not taken the advice of the Gov, had we not made these sacrifices that you're making at home. Instead, 10 people have died. This number would have been catastrophic. This is what would have happened if we had had a surge, and it probably would have surged to a peak sometime last week. Now, we're not out of the woods yet. There's obvious concerns still, and we have a lot of planning to do with Alan and others, but you've done something extraordinary, and that's why I wanted to share that with you. Just the last couple points. Some people have been asking about masks for all people. Well, there is a circumstance, this is me putting my physician hat on, there is a circumstance when people can't wear a mask. If they have chronic lung disease, COPD, or severe asthma as young children, in some cases the CDC has not recommended that people wear masks because it could do them more harm than good. We still recommend people socially distance completely, but please be careful about criticizing others in communities. If you're at the store, if they happen to already have trouble breathing and are not wearing a mask, it may not be as simple as you think. They may have underlying lung disease, and that's why they can't wear a mask. Finally, I know everybody wants to get back to normal. The Gov, we all want you to get back to normal. That's why we're so impressed by your commitment to staying at home and avoiding a catastrophic surge in our state. Just please know that COVID-19 is bound to be a part of our lives for some time, but that doesn't mean we're not diligently working to ensure a return to normal and opening up Hawaii. That's what you're going to hear from Alan, some of the early plans. Obviously, the Gov's keeping you up to date very often. So please don't lose hope, don't lose faith. Know that you've done something quite extraordinary. Aloha.
Thank you, Lieutenant Governor. Our next speaker is Alan Oshima, lead of the Economic Recovery and Resiliency Effort.
Thank you. I'm happy to be able to share some work that we've been doing over the last week. As the governor indicated, the real need for speed on coming up with plans to address the economic recovery and the social recovery from this pandemic. And it's not just the economy, it's what it's doing to every family, what it's doing to every community, what it's doing to our culture. So we are going to share with you today something that we've come up with as our framework for making decisions as we move through the various phases of economic and social recovery. These are the, I'm going to share just a few of the slides that's available in a whole slide deck, and you can see it all at our launch page for our website, and that is Recovery Navigator at hawaii.gov. So if you go to the launch page, you can access the whole deck. So I'm not going to spend a whole lot of time going through each of these selected slides, but be able to express to you what we're trying to do as we move to economic and social recovery. So this, and I don't want to make light of this, the pandemic gives us an opportunity to be very introspective and accountable for our future. So what we have to do is this unique opportunity to transform and challenge all of us, right? Connected, digitally enabled, collaborative, resilient, diversified, and engaged. This is what we're calling on each and every citizen to be able to do while we get through this. We hope to give you the framework for using this. Our guiding principles: health and safety first. Absolute. The governor's made it very clear, public health has to be assured. That we will work in a collaborative, inclusive, and transparent manner, which is why we are in the process of setting up a very robust database online so that everyone will see everyone's opinions in a resource center. We'll fill it with data. We'll fill it with best practices, etc. And then we have to respect and incorporate Hawaii's values, unique sense of place, and way of life. This is a very high-level plan to reopen the economy. The first phase is what we're in now, and that's stabilization. So you can see what we're trying to do in stabilization, and I'll give you more of that later. But we really have to address the critical needs that are facing us now. Food needs, shelter, essential services, public health. As we move through this and we reach some stability, we can now start to plan on what we call reopening. And for that, even as we talk about reopening, we will have discussions about a phased approach and which types of businesses are best to start the economy again. 6 principles will guide the decision. We have to have clear priorities and goals, engage stakeholders, and ensure transparency. Use fact-based decision-making, leverage national and global best practices, consider federal, state, local, and private funding sources, and focus on the need for speed. We cannot slow roll this. We have to have answers. It may not be perfect, but we have to move. This is kind of the state policy priorities on stabilization. You'll see in the first column. Maintain the low infection rate, ensure availability of food, ensure adequate shelter, preserve and build system capacity, health system capacity, and keep the economy alive. As we move forward, there are various things that we have to do, and you'll see them all there. You're familiar with them, but a lot of them have to do with funding and health practices and equipment. As we move to the next phase, we'll have to open in phases. So the reopening gradually will set some priorities, right? Mitigate virus resurgence, reopen the economy, re-enter the workforce, support local businesses and nonprofits, return to school at the appropriate time, and open phased-in travel. We will have to come to some discussion and decisions on which businesses to open first. This has to be a soft opening of our state, not one for all. You look at the left side, healthcare readiness, that's the foundation. And for that, we rely on public health experts to say, when can we move? But we, as the economy and community navigator, have to look at preparing for that opening. So business preparation, public response, and government preparation. These are things that we're looking at now so that we're ready to open in a rational way when the time is right. We'll then get into recovery phase. After you pass the first reopening, we want to then increase the access to disease prevention. Continue phased-in travel. So you can see this is a ramped-up method. Support the full return of the workforce and reshape the economy. Finally, we'll get into resilience, and that's the future of Hawaii. Those discussions we hope to be very robust across our state in all settings, hopefully in person by that point, but maybe digitally. It'll be as required by the public health. So with that, I leave you with kind of a framework, and thank you, Governor, for giving us this chance.
Thank you very much, Alan. Our next speaker is Bruce Anderson, Director, Department of Health.
Aloha, everyone. Some good news today. There were only 4 new positive test results for the state of Hawaii. All 4 new cases were adult residents. 2 were are new cases on the Big Island, and 2 are on Maui. With these cases, there's a cumulative total of 584 positive test results since the end of February. To date, there have been more than 24,500 laboratory tests conducted for Hawaii, and the percentage of positive test results is about 2.4%. Considering the amount of testing that's being done, that low percentage is expected, but it's given us a good understanding of what's happening in the state. The amount of testing in Hawaii certainly remains high relative to other states and other countries around the world. The Department of Health is continuing to work closely with Maui Memorial Medical Center on the cluster of cases identified at their facility. At this time, the cases appear to be contained and controlled. There are no new cases attributed to this outbreak after the implementation of the universal use of face masks and daily symptom screening for all the employees, which occurred on April 8th. A total of 42 people, 27 staff, and 15 patients have been under investigation as potentially associated with this cluster. This outbreak appears to be the result of a single individual who went to work while ill, who infected others, and of course, even some patients. We continue to urge people to stay at home if you're sick. Working while ill can have devastating effects on coworkers, clients, and the entire community. The active investigation of a cluster of cases associated with the 3 McDonald's food establishments in Kona is also continuing. There we have a total of 30 positive cases associated with this outbreak. This includes 18 employees and 12 household members, all of whom are in isolation and quarantine. The investigation is ongoing, but so far we haven't found any customers to be impacted. As you might expect, co-workers are often working shoulder to shoulder with each other, and they're typically at the highest risk. And of course, household members, particularly when crowding situations exist, are also at high risk. This outbreak can be attributed to someone going to work while sick and not carefully isolating themselves at home to prevent other family members from becoming ill. It's critically important that people who are sick stay home. Community members need to be vigilant and practice social distancing and preventive measures such as staying at home when sick, avoiding others that are sick, washing your hands regularly, sneezing and coughing adequate, and wearing a cloth face mask, as the governor has announced, is going to be key to our keeping this situation under control. The Department of Health has revamped our website, and I would like to show you a few slides on what is available now that may be of interest. On my left is the epidemic curve. This is the curve we all talk about flattening. As you can see in the curve, the date of onset of the first cases began on February 17th and peaked out in mid-March. You can also note on the curve here that the dark blue bars represent individuals who are traveling. These are residents, by the way, who returned to Hawaii. The light blue on those bars represents visitors coming to Hawaii who weren't residents. And the red bars are the number of cases of individuals who had no travel history. And there's been a clear shift from people who have had travel history to those who do not. We're expecting that to continue. Let me just add, the end of that bar chart there is tails off, and I wouldn't, the new cases are not identified there. Again, this chart is of the date of onset of cases, and often that we get a report as long as a week after the date of onset before someone's gone to the doctor and gotten the test results back. But the results are very encouraging. The curve is definitely going the right way. This map is updated weekly. It shows the zip codes of those who are infected. I want to emphasize that no zip code is safer than any other zip code. This is a cumulative total of cases. So the dark red indicates the higher numbers of cases, and that typically represents areas with dense populations or possibly people who have traveled more than in other places, and is most likely associated as much with population density as it is with anything else. Again, there's no reason to think that someone living in a zip code without a case is at any less risk than others, but it does give you an indication of the widespread nature of this problem historically. This is another chart of age distribution in the state. What's interesting to me on this chart is that we've had no hospitalized cases among those under 18, 0 to 19 years of age, and the lowest number of cases in that group. On the other hand, when we look at the age groups 60 and over, we do see a large number of hospitalized cases. Those are depicted in the with a red color on these bar charts, and it's typical of what you would expect to see. Hawaii has a relatively old population, so we would expect to see more cases among old individuals. And by the way, for that reason, our community is at probably higher risk than many other communities because of the age distribution in our population. This bar chart shows the number of tests done per county. Obviously, the city and county of Honolulu has the largest population, and we've done the most testing on the city and county of Honolulu. However, the testing frequency in all counties has remained between 1.7 and 2.9%. Is relatively consistent between counties. So we're not missing things here. We're consistently looking at the disease in all counties. This slide depicts the number of tests being done across the state since the beginning of the testing that was available. The state is doing as much testing as any place in the country, and more than most. On this bar, you can see the very low number of positive tests relative to total tests, again indicating that we're not missing a lot of individuals who are ill. And finally, I wanted to show you some bar charts that show how we rank with other states. This is a chart that shows the total rate of confirmed cases by state for every 100,000 people. This is a week-long period from March 7th to April 18th, essentially over the last week. And as you can see here, Hawaii has the lowest number of cases per 100,000 people of any state in the country. This is a chart, looks the same, but this is actually a chart showing the total number of deaths per 100,000 population. Over this 1 week period, we also had the lowest number of deaths per 100,000 population of any state in the United States. So I think we all have a lot to be proud of in terms of how we've kept this disease under control. We're certainly doing as well or better than any other state in this regard, and we need to keep it that way. The two clusters of cases we saw over the last few weeks at Maui Memorial and in Kona only indicate the potential vulnerability we have and the potential for us to see increased numbers of cases very rapidly, where we would need to respond quickly. And I'm very pleased that our staff were able to get on those cases, identify contacts, do all the contact tracing that was necessary, and all those individuals who were cases or close contacts are now being isolated, and hopefully we have those situations under control. If you take out those cases, you can see that we have a very low number of cases overall. That's because of all the efforts that have been made among all of you to help control this problem here in Hawaii. That's the end of my report.
Thank you very much, Dr. Anderson. And now we begin our question-answer period. Our first question is for Governor Ige, and this comes from Kristen Concilio at the Star Advertiser. Her question is, Are protesters going to be cited or arrested for not adhering to the social distancing order?
You know, we definitely are looking at the protesters, and we will be reminding them, you know, it is an educational process, and so I do know that law enforcement are providing them what the guidelines should be and suggesting how they could voice their concerns in a way that is appropriate. So we'll be reminding them.
And that question and answer session continues on our website at khon2.com. And if you don't have a web access, we will also be bringing you all of the most important questions and answers that come of that session later in our newscasts that begin at the KHON2 News at 4 and beyond. Please do stay with us for all of the evening's newscast. Also, download our app. It's the KHON2 app. We can keep you posted if you allow notifications when you sign up for that. We'll tell you about all the day's news and important events like these midday breaking news information sessions. Thank you so much for joining us, and we'll see you soon for all of our evening newscasts. Stay safe and stay well. Aloha.